Unsatisfactory weight loss. While unsatisfactory weight loss sometimes occurs after the lap band system is in place, patients will be able to better cope with poor outcomes if preoperative education has prepared them for this type of result and offers realistic expectations. Practices that develop good support systems for these patients and have a plan for both assessing and managing unsatisfactory results will be able to help these patients move forward again with their weight loss. Be sure your practice is prepared to deal with poor outcomes. As we saw earlier, the key to satisfactory weight loss is a strong follow-up plan. Remember, there are no failures, only delayed successes. It is your role to identify the barriers and develop a plan to get patients back on track. There are very few preoperative indicators of ultimate weight loss outcomes. Most of these indicators are basic physical or pathophysiological characteristics, such as age, disability, mobility, weight distribution, and insulin resistance. There is negligible evidence confirming the importance of preoperative dietary, psychological, or behavior indicators in weight loss outcomes. On the other hand, there's increasing evidence that with the lap band system, consistent follow-up, hunger reduction, and adoption of new behaviors have a major influence on weight loss outcomes. It is also clear that some patients just get it, and the weight falls off after surgery, while other patients struggle to achieve satisfactory outcomes. There may well be individual variations in gastric stretch receptors, vagal afferent signaling, and central control of energy balance that alter the way the lap band system works physiologically. Certainly, there are many genes associated with obesity, obesity-related conditions, and typical behaviors. This is an area of ongoing research.
So how can you minimize unsatisfactory weight loss? It starts with excellence in the preoperative preparation and education, followed by ongoing education and support postoperatively. Minimizing unsatisfactory weight loss. Decrease barriers to get consistent, adequate follow-up and appropriate adjustments. Provide access to care in appropriate locations and times and at a reasonable cost. Provide regular, monthly follow-ups in the first year and routine follow-up long-term, as well as easy access for acute or as-needed appointments. Support, encourage, and have empathy with the patient. Don't give up. If you give up, patients will give up. Have a back-on-track plan in place for patients who experience unsatisfactory results or weight regain. Have a range of strategies to assess and manage various aspects of poor weight loss. Every patient comes into the decision to undergo lap band surgery with the intent of being successful. As you deal with the reasons for unsatisfactory weight loss, you should keep in mind that the patient is likely to be disappointed with the results and might even feel guilty. It is important that you approach the situation as a team focused on making every patient successful. Without a non-judgmental, positive, and team-oriented plan to move forward, early unsuccessful patients may soon be lost to follow-up. Put a strategy in place for addressing and helping overcome poor outcomes. Begin with a full appraisal of the situation. Patients often have a range of reasons for why they are doing poorly after surgery, and many of these reasons compound the problem. For example, if a small hole is created in the port tubing by an errant needle stick during an adjustment, fluid will leak out of the band and will no longer work effectively. As a result, the patient will likely experience hunger, weight gain, frustration, and disappointment. The patient will feel that the surgery has failed. Dejected and depressed. This patient may feel too embarrassed to return for follow-up visits until their weight is under control. Yet nothing seems to work. The weight gain continues. If you're lucky and the patient finally does return, you're confronted with a depressed, ashamed patient with a range of problems. If, on the other hand, you tell patients ahead of time that they must immediately see you when they first detect they have reached a plateau in their weight loss or they're not losing any weight, you can address the following. In case of lack of weight loss, tell patients to see you immediately so you can. First, interview the patient about his or her new eating habits. Second, run diagnostic tests to catch complications before they overwhelm your patient or become dangerous to his or her health.